Anatomy of rotator cuff. In human body, the rotator cuff is a functional anatomical unit, located in the upper extremity. The rotator cuff is a group of 4 muscles and tendons that keep the shoulder joint stable. These muscles also allow the shoulder to rotate safely. These muscles start at the shoulder blade and wrap around the head of the humerus, forming a cuff that keeps the arm in the shoulder socket. Mnemonic to remember the rotator cuff muscle is sits. Stephen is terrible singer. S stands for supraspinatus. I stands for infraspinatus. T stands for teres minor. And S stands for subscapularis. These muscles originate from the scapula and insert in the humerus. The supraspinatus muscle has its origin in the supraspinatus fossa and inserts on the greater tubercle of the humerus. Its function is to initiate the abduction of the arm. The infraspinatus muscle originates in the infraspinatus fossa of the scapula and inserts on the greater tubercle of humerus. Infraspinatus is a strong external rotator and additionally assists in both abduction and adduction. The teres minor muscle originates from the lateral border of the scapula and inserts on the greater tubercle of the humerus. The function of teres minor includes external rotation and adduction of the arm. The subscapularis muscle arises from the subscapular fossa and inserts on the lesser tubercle of the humerus. It is a powerful internal rotator of the arm and also supports the arm during abduction and adduction. Rotator cuff injuries are very common. They can range from chronic inflammation to tears in one or more of the rotator cuff tendons. Some common rotator cuff injuries includes tendinopathy. It causes pain in and around the tendons. It can develop from age-related degeneration, overuse, repetitive motion, and trauma. Impingement. This occurs when the acromion process of scapula rubs against the tendon and the bursa and irritates the rotator cuff. This is the most common shoulder disorder. Bursitis. The bursa around the rotator cuff can fill with fluid and swell. Partial tears of the rotator cuff tendons. In partial tear, the tendon is damaged but isn't torn away from the bone. Full thickness tears. The tendon is completely torn from the bone, may be due to chronic degeneration. Bone spurs. These can form when rotator cuff tendons rub on the shoulder bones. Bone spurs don't always cause a rotator cuff injury. To watch more such informative videos, hit the subscribe button and press the bell icon.